Yeah.
Good. Good. So good morning, everybody that is here. Thank you very much for attending. In the name of the four organizers who are there, Joao, we cannot see him, but he's there, Rita and Irena, who still shows as Rita as well. I'm very happy that we can hold this meeting, no matter the complication of that COVID has meant for all of us. And I'm especially happy that we have managed to put up a very nice program with two star speakers. I will be very short, but I think that in a year such as this one, the notion of data science contributing to social good is especially relevant. And we have become aware of this by painful experience. So it's good that this has still a recognition, as it's beginning to get more and more recognition, I think, as a distinct field within data science. Okay, let me not go long, just say that I will be chairing this first session that consists of a keynote talk and the best paper award. And without being much longer, let me introduce the first keynote speaker, Natalia Adler. It is a big honor because, you know, many of us talk about data for good, but Natalia is one of the few that really walk her talk, okay? Meaning that she has immersed herself into the problems, not just on the technical side, but working on very tough real problems and and being there actually on the terrain. Okay, she starts by having a master in human rights, and she's been for many years at the UNICEF trying to put innovative solutions for social problems, and this includes the problems such as epidemics, suicides, urban mobility, and forced displacement, working in at least three continents. That's very impressive. Out of her experience, she has recently funded Pebble Analytics, a citizen science-based startup aimed at predicting and managing social risks. And sure enough, she's working hard on the COVID epidemic these days. So looking forward to this very interesting social good talk, based, I think, on her experience of actually applying and fighting the real problems in that. When you want, Natalia. Thank you.
Thank you so much, Ricard, and good morning, everybody. It's such a pleasure to be here. I'm going to start by sharing my screen, and just let's make sure that it goes smoothly. Can you all see it?
Yes.
Yep. All right, great. So let's get started. As Ricard mentioned, my name is Natalia Adler. My Twitter handle is Natalia Adler 19. If you guys are into that, we can collect data afterwards. But I want to start it from the beginning. And don't worry, because I'm not going to go back in my childhood history. But I do want to share a few of my experiences working with the United Nations Children's Fund, UNICEF, particularly in the area of data for good. It all started a few years back in 2014 when I was working in our headquarters in New York. And at the time, the Secretary General had just launched an initiative that was seeking to take advantage of what was so called at the time the data revolution. There was a large recognition that there was a lot of data out there, new techniques on the table, and we needed to make sure that we could apply that for good. But at the time, nobody really knew how did that work and what we needed to do. My own first experience was when I was working in headquarters in New York with our data research and policy division. And it was actually during the Ebola crisis. And it was the first time that we had used data science in a significant way. And we use actually call detail records, CDRs, to better understand the mobility of people, which, as you know, based on the situation today with COVID-19, is very important when you are talking about infectious diseases. Because if you know how people move, you are able to better target different kinds of interventions and contain the spread of the disease accordingly. So let me actually show the example of the work that we're doing. In this map, you'll see that at this particular time, there was no cases of Ebola in Freetown, the region highlighted in purple. But we knew there are still a few cases of Ebola in Kafue, the region highlighted in green. And we also knew from the data from the CDRs that 41% of people were traveling from Kafue to Freetown on a regular basis, mostly for economic reasons. And we had the level of granularity to actually know that they were not going to just any region in Freetown. They were going to the East 2 region on a regular basis. So 1 week later, lo and behold, we had new cases of Ebola in Freetown. But again, not in any area in Freetown, but exactly in the East 2 region. So we got really excited with the potential of using these kinds of emerging sources of data to help us understand and act upon these very complex problems. So that when Zika appeared in Brazil, we thought, okay, we should layer as many data layers as possible, including epidemiological data, municipality level data, poverty data, weather data, roads, the dispersion of roads, with call detail records as well to understand how people are moving, but input all these other data inputs so that we can understand and model disease spread. So we were very excited about all of that. However, the difference was that in both cases, what actually really happened was that we didn't have really data access, or not at all, or in the case of Ebola, a bit too late. And that was one of the first interesting moments for me in this space. Because in the case of Ebola, by the time we finished negotiating with the mobile operators on the ground to have access to the data, it was a bit too late. That's why you only see a few cases of Ebola in the example that I just showed you. But it took like around 6 or 7 months for them to be able to release the data. And by the time we cleaned it and we started working on it, Ebola was already on its way out. In the case of Brazil, we actually had the experience from Ebola, so we were able to jump on the negotiations with mobile operators on the ground very quickly. However, they said that they were very happy to help us with the data. It's just that it would cost us $3 million a week. So this was part of like these aha moments that I had at the time, that when it comes to data for good, access to data is extremely important. And because this is a space where data has become very monetized, it's not easy to just think that these organizations, particularly the private sector, will use it for good without seeing the bottom line. And another thing that became very important and very clear to me over the course of the years was around the ecosystem itself. So of course you do need organizations that are sitting on very complex problems. In fact, it always starts with that one. But these organizations are not necessarily looking at this space except with a few, what we call at the time, positive deviants, those people who are looking for different ways to use data. But this is not necessarily the norm. Another important actor that you need in this ecosystem is, of course, the data scientist. Unfortunately, there are not a lot of them sitting in organizations that are working on data for good. And I will explain more about that. And last but not least, you needed a data provider as well. And as I mentioned before, it also became very clear that when it came to these very relevant data sets, for us, the majority of them were just sitting with the private sector in the form of like buttons, search queries, CDRs, you name it. And getting access to those data sets, as I mentioned before, was not easy. In addition to all these problems, what also was happening a lot at the time, and I think it continue happening as well, is the fact that you have data scientists running and trying to do as much as they can alone, meaning they look for problems, they already have some solutions, and then they try to fit the solution to problems, and that becomes very difficult. You also have more examples today than when I started of data providers, or especially the private sector, engaging in this area voluntarily. And voluntarily here, I probably can be a little cheeky when I say that, because I think there has been quite a lot of pressure, and especially on the big tech giants, to use this data for good as well as part of their own PR efforts. And there's nothing wrong with that. But what is also missing in this ecosystem is that the organizations that should be looking for these different kinds of solutions and alternative uses of data are not doing so. And they're not doing so for many different reasons. And some of which are that they're not used to it. They have so many problems in their hands. They are risk averse, and you name it. So this ecosystem does not work by itself, and it must work. And this is part of the work that I was doing back at UNICEF, is to try to create and triangulate these relationships in a way that really solidified the way that what we saw at the time, the data for good ecosystems should work. And according to the methodology that we had developed, it always started with a problem, always. So no matter if you are a data scientist sitting there and thinking that you have an amazing solution, you really needed to start to talk either to governments, nonprofits, NGOs, organizations that are sitting on the problems, and see if the problem that you're dealing with is indeed very relevant. Ideally, this would start with those organizations. And at the time we created very rigorous problem statements to see if the problem was worthy of applying so many of these techniques, which, as you know, is not that simple to do. So doing that homework really helps. Of course, you needed the data scientist as well. And after we had these problem statements, we would engage and brainstorm with lots of data scientists around the world what was the best way to tackle those problems. And we generated lots of interesting leads on that. And after we did that homework, we then would approach data providers, particularly in the private sector, to see if their data and collaborating with them would help us tackle some of these complex problems. So I kind of saw myself as a little bit of a matchmaking between all these different organizations. It was kind of like the Tinder of data for good. But of course that name was taken, so we decided to call it Data Collaboratives instead. And we worked with GovLab at NYU to develop this methodology, and you can read a lot about it on the web. So let me actually give you some examples of some of this work that we did along the years to, one, test the methodology and also showcase the potential of this triangulation of individuals and also of the different data science techniques. Let's start, and I know it's Friday morning, so I apologize for that, but let's start with suicides, and in India in particular. As you probably know, suicide is a global phenomenon, and there's quite a lot of them cases around the world, but India is home to actually 20% of the global suicides in the world. And we believe that that's only the tip of the iceberg. Only a few years ago, suicide attempt was considered a crime in India. And there's a lot of stigma associated with it. So we believe that people, when they commit a suicide or when their family members do not even want to report as such. So underreporting is a big problem. So we decided to look at how the web could give us insights about suicide ideation and help us understand the complexity of this problem. So we created, as I mentioned before, very rigorous problem statements. We saw what was out there. We saw what the current solutions were, especially in terms of data. And we decided this would be a really good example for us to use alternative sources of data to complement the existing understanding in this space. So we worked with many different organizations, and in particular, we got access to data from Microsoft, in this case, search queries. In this particular example, what we did was to extract a few English words related to suicides, and we combined that with demographic data per state in India. And that helped us understand the official suicide rates in a much better way in many cases, because it allows us to identify the hidden factors such as underreporting and overreporting. And sometimes our models for suicide rates per state would do much better than official data, because it would show these hidden factors of underreporting or overreporting. What is interesting about this particular research that I would just want to highlight a little bit more was that one of the things that we found out is that one of the best predictors of suicide ideation at the time was not related to when people search for, let's say, how do I commit suicide, for example. So suicide is the keyword, but it was much more related to the methods of suicide. So how do I poison myself? How do I hang myself? Those were much more bigger determinants, at least in our models of suicide ideation. And what is interesting about this is that, at least at the time, whenever you search for those keywords related to suicide, usually an alert system would come in that will connect you with a helpline desk. But that alert did not come up when you actually searched for methods, which in our model was a better indicator that you were really contemplating committing suicide. So we actually reached out to, obviously, Microsoft and Google at the time to alert them about this issue. The other example that I want to spend a little bit more time on is around the Venezuela crisis. And as you probably know, this is one of the worst exodus in recent history in the world. There's, according to data today, there's about 4.5 million Venezuelan migrants around the world, and particularly in Latin America. So back in 2018, I went to help our office in Brazil deal with some of the Venezuela migration crisis, because there was an influx of migrants from Venezuela entering the country. And one of the things that I immediately noticed when I got there was that there was a lot of good data, official data from the federal police, identifying how many Venezuelans came into the country and how many Venezuelans left the country because of the border control. All of this was very well done. However, Brazil is a massive country, and there was no clear indication where the migrants went after they crossed the border. The perception at the time was that most of them just stayed in the border states. But again, we're not sure. And then again, if you're not sure, how do you design interventions to benefit this population if you don't know where they are? So in this particular case, we start looking at social media data to help us understand the better flow and mobility of migrants. And we work with different organizations to do this work. It was done actually very, very quickly because we needed the response at a significant amount of time so that we can design the interventions that I mentioned earlier. I'm going to give you two examples here. The first one was we used Twitter data. This was geolocated Twitter data that some of our partners have been collecting through the API from Twitter since I think 2014. And it was very significant because, as you can see even from the map, it allows us to understand the distribution of migrants in different parts of the country. And we were able to see for the first time, actually, how migrants, yes, indeed, there is a high concentration in the northern and the bordering towns, but they're not just always there. They were always, they actually migrated to the bigger cities, especially, you know, in this case for me, it was important to know the situation in Brazil. It also confirmed one of the assumptions that we had before, that it was a lot of recurrent travelers, let's say. Migrants would cross the border, stay for the day or stay for a little bit in Brazil, get some money, do some odd jobs here and there, but then they would return back to Venezuela. So there was quite a lot of that kind of migration. We also could see, and you can almost detect different routes, and they actually match the different roads, and sometimes because of the Amazon, the different river routes as well. And we had the level of granularity that we could even look within cities to understand the level of segregation of migrants within cities as well. So this was, at the time, even though it was a little bit raw at the time, now it's a paper, but at the time it was very raw, it was very important for us to understand that kind of dispersion of migration in Latin America. We also worked in collaboration to use Facebook advertisement platform to better understand this kind of segregation of the migrant crisis. And this was interesting because really the Facebook's advertisement platform was not designed for this reason, but we're trying to find a way to, at the time, like a clever way to just give us insight about where these people were. And this was something that normally advertisers would use to better target their preferred audience. So we use the same format to understand if you were Venezuelan who was living outside of your country of origin. So we use that as a basis, and then we're starting to filtering down, and we are able to understand, similar to Twitter, the kind of segregation of the mobility of migrants across Latin America, including per states or provinces in different cases. And we also were able to obtain information about the level of education of some of these migrants. Of course, it's all self-reported, and we took that as into consideration. And also we could infer, for example, the income status based on iOS ownership as well. Again, a lot of assumptions, but that at the time was actually really helpful for us to design campaigns that went beyond regional responses, which we thought before, to a more national level approach, especially the ones that concentrated on cities as well. The last example that I want to give from this time, is around gender and mobility in urban settings. And this is a subject that is very close to my heart, not only because I'm a woman and because I take public transportation, but it's one of those subjects that we all know that theoretically it makes sense that when it comes to moving around in cities, it's very gendered. Women move around in different ways. It doesn't matter where you are, but if you see maybe a group of people that look a little bit suspicious, if you're a woman, you might be tempted to cross the road to avoid that group of people. If it's too dark, women feel a little bit more vulnerable. And there are many different ways to navigate a cities, and it starts very early if you're a woman. And we looked into one city in particular, in this case was Santiago in Chile, where we knew that there was a lot of gendered issues with mobility, including sexual harassment, and there was a lot of good data that we could use. So we went actually in a data collaborative with lots of different partners, and including Telefonica, from which we used CDRs again. And in this case, it was a very interesting paper because we actually had, contrary to other situations, we had lots of data. And in the case of CDRs, we started with over 2 million CDRs, and then we filtered it down to about 500,000. And we have within those CDRs, we have access to information about the contract. So we knew if you were, of course, this is all anonymized and aggregated, but we knew the sex, we knew different kinds of demographic information, and we paired it with the census in Chile, which is again very granular and provides quite a lot of information. We used information from the public transport system, so we knew where the public transport was going, where it stopped. And we also took information from OpenStreetMaps to understand the different kinds of points of interest. And the result of this work was not at all surprising, but it confirms some of the assumptions that we had before. And I think this is actually quite important. We found out that indeed women visit fewer locations. They are much more localized when you compare that with men. We also found out that gender inequality when it comes to mobility increases with income inequality. In other words, if you are poor and you're a woman, you are more likely to be more localized than if you're a richer woman, for example. What was interesting here, and we saw this very clearly in our research, is that access to transport reduced mobility differences for men in all socioeconomic segments, but not for women, or not as much for women. In other words, it didn't matter if you provided more access to transport for women, that would not be the only thing that would make them move, which is very interesting if you're working in policies around public transportation. And we also saw, and I think this is more a confirmation, it's not necessarily surprising, but it's a confirmation that when it comes to where women go, this is also very gendered. Women tend to be the ones going to hospitals, going to schools, going to malls. And I think this also confirmed the locations that they would go. So this was a very interesting research. As I said, it was a very grounded, we have quite a lot of data. It was very powerful in the arguments that we had. And we talked a lot with different authorities in Chile, and including Uber in Chile, so to make sure that these insights could be leveraged and make sure that these differences in inequality and mobility could be somehow diminished. But then the question is, then what? So here I can tell you about the challenge that we have in translating evidence into actual results. But I think in many ways, this is not to say that this is something that pertains to the data science space or even the data for good space. It has always been difficult to translate evidence into results or into practice, if you will, because as human beings, we're not necessarily just motivated to act upon reason. And we know that. If we didn't know that, people would stop smoking, for example, or believe that climate change is man-induced, most of it. But that's not the case. So I think there's quite a lot of examples that I can give on the difficulties in translating all this evidence we had generated into actual change. That's not to say that there have not been some progress here, but it's hard. It is hard. So I think one of the first things that I would like to share with you is that being interested in this space, it's very important to show results, but showing results require a lot of leverage, a lot of advocacy that sometimes people in the space are not necessarily equipped to do. And that's why the data collaboratives that I've mentioned before, that triangle is very important, because once you finish doing your research, it has to go back to the advocacy part, and that sits with the organizations, big government, nonprofits, etc., that should be pushing for change based on that evidence. But I think here, what I would like to highlight more is going back to that ecosystem. So I mentioned before the matchmaking process of trying to hold these different players and actors together. And And even though we produced a lot of interesting research, and we managed to create the collaboration and the engagement and the relationship with all these different players, the truth of the matter was that if you remove the matchmaking component, all these relationships are very flimsy. In other words, they really don't work on their own. And what you have in many cases is the situations where the organizations that should be pushing for change in this space, they don't do that, either because they don't put the money in the space of data science, they don't make investments in this area, they don't think it's a priority. It's still seen as an innovation, and sometimes innovations in these organizations is done by a very small group of people who are trying to change the system in big ways, but it's not scaled, even within these organizations. And many times you have to fight internally to show that this work is worthwhile. And this is not just in organizations. A lot of the hurdles that I have faced, for example, in translating all this evidence into change, is that a lot of times governments think that this is very interesting, but it's not robust enough. So there's quite a lot that I think it still needs to be done in a data science space to showcase that this is serious science. This is serious research. It's not alternative. It's not emerging necessarily, and it's been around for many years. But somehow that communication piece is not yet there. The other part that I think it's still missing quite a lot is around is around the corporate world. You see more examples now of data providers sharing data, especially the big tech giants. They have engaged more in this area. I was part of many of these conversations with some of these big tech giants, and I can see that there has been definitely more effort. We're seeing it more now, but I still think it's isolated. It's still done in an ad hoc way. It's still done out of the goodwill of some of these organizations, and it's done in a very, I would say, exclusive way. There's a little exclusive club of organizations that get to play in this space. And I don't think there's anything wrong with that per se, because obviously there's a lot of sensitivity with the data here, but it's still a very closed and ad hoc scenario. And of course, when it comes to data scientists, a lot of data scientists are doing these things, without much guidance. They do it because they think that's what they would like to use their superpowers for. They do it because they're interested in this, but without that connection that I mentioned earlier, without understanding that what the real problem is. And what happens is that it may produce amazing papers, but they will remain in that space for a while, because it doesn't trigger the entire chain of change that is required to do so. So for me, all of that was a very sad realization that a lot of this work, if you remove that kind of matchmaking process and people trying to creating these connections on the side, it's just not sustainable. And that for me was very disappointing. It does not mean, however, that it cannot be done. It's just that it's not sustainable and it's not scalable. And you just have to be the ones creating the connections by yourself. So unlike Tinder, there's no algorithms to make this work sustainably. So for me, it was also a moment of realization that if you believe in this work, you actually have to create the change from within. And that's what I did. So in December of last year, I left UNICEF after 14 years with the organization to create my own startup, Pebble Analytics. And Pebble Analytics is a social impact startup that leverages technology, data science, and market solutions to forecast complex social risks. Not unlike the work that I was doing before, but really now bringing the market solution part to the discussion. And we decided to start with epidemics, this was in December of last year. So as you can imagine, it was quite timely, maybe not timely enough, but it was definitely, we were well positioned for what was to come. And COVID right now, as you probably all know, is forecasted to claim the lives of over 2 million people and have a global cost of $3 trillion. And it might even be more, depending on the scenario that you're looking for. But again, even though COVID-19 is one of the worst pandemics in more than 100 years, we all know that 3 million children die every year due to preventable infectious diseases. So epidemics might not be as making the news anymore, not like COVID, because it's not happening in Europe or the United States and North America in general, but this happens every year. And a lot of the times it has to do with infrastructure problems of national health institutes, particularly in places like sub-Saharan Africa and in Asia, where most of the epidemics come from. And a lot of that is true, but also the simple fact that we do not have the capability to detect diseases quickly and accurately enough. And this is not something that only happens, you know, in Africa or in Asia. We have seen this in Europe. We have seen that there is a delayed gap for us to detect these signals early enough. And it's quite sad because COVID-19 will not be the last of epidemics that we see. It's not. The World Health Organization estimated that every single month there are over 7,000 signals of potential infectious disease outbreaks coming up that could become a pandemic. 7,000 a month. So our solution within Pebble Analytics combines different approaches to deal with the problem of detection and forecasting. And it uses a way to look at it from a bottom-up perspective, where we collect the data directly through citizens, to a top-down approach in terms of science, where we use forecasting early warning systems, and then we embed sustainability issues throughout. And I'll explain a little bit more about that. The way that traditional disease surveillance work, and this is true for almost all countries around the world, is that you collect the data from death certificates, hospitalizations, and your visits to your general practitioners. That's when we know that there's something happening. That data, so you're sick, you go to some of these hospitals and clinics, they're authorized to collect the data. That data is shared to a certain, a central institute, usually a research center or a national health institute, and that's how we know that there's something happening in the situation in the country or in a region. But what if you don't think you're sick immediately? Or what if you don't go to see a doctor, or you don't go to a clinic? And that's what we are trying to change. We want to collect the data from the general population itself. So even if you're not sick, we're trying to collect data from you. And that is called digital participatory surveillance. And it's actually based on a methodology that has been validated for the past decade and has been used by InfluenzaNet in Europe in 11 countries. And for the past 10 years, it has been, as I mentioned before, very much validated and in many different countries in the United States as well. It has been used in Australia, and where you collect the data directly from citizens who report their symptoms on a weekly basis. And it has been used to allow us to forecast flu outbreaks trends up to 2 and sometimes even 4 weeks ahead of time. The interesting thing here is that you not only understand these trends in outbreaks, but you're also able to obtain information that you normally would not obtain otherwise through the traditional surveillance system that I described earlier. You can find out information about the household. You can ask information about elderly people, about children. You can understand vaccine coverage. You know if people are seeking doctors if they feel certain symptoms. You know the drug uptake appetite that they have. You can have longitudinal data that is really important on healthy individuals. You can actually collect the data from animal health as well, which is incredibly important because the majority of these epidemics come from animals. And it's, most importantly, it's actually quite cheap to do it. We have the technology out there, and then it can be applied to emerging countries as well, which is not the case, by the way. As I mentioned before, this approach has been in place in Europe, has been in place in the United States, has been in place in Australia. And what do these countries have in common? Well, they have already good disease surveillance systems, but the countries that need it the most don't have it. And that's where we are trying to change it. So in the midst of the pandemic, when we were all quarantined, and as we were busy putting together a company, building a website and all of those very basic things, we started very quickly to produce a mobile app along with the government of South Africa to allow them to collect data from citizens directly. And again, this is all precedes, the idea precedes COVID. So this is not an app for COVID-19, but it was adapted for COVID-19. So this is much more long-term. We're expecting to collect data on a range of diseases that can help the government of South Africa understand the situation much better. But before we actually developed the tech, we wanted to understand the user needs and even the level of technology penetration in South Africa. So we launched a survey to over 1,000 users. In 48 hours, we collect quite a lot of information where we were able to detect that there was a willingness to respond to these kind of online surveys, that a lot of them were using smartphones and they did not have problems with connectivity. So we were very confident that we could produce the app and to do so. And we also tailored the syndromic questionnaire to respond to COVID-19, but also to be open to different kinds of acute respiratory infections as well. The app has been translated in 10 out of 11 official languages in South Africa, which is very important for the users as well. We worked with them to develop an ethics protocol, and we are also supporting them with massive user acquisition and retention campaigns and strategy. Right now, the app is being tested to a small group of people, and it should be rolled out in the next few weeks. So once we have the data, that is only part of the story, but it's a very important part of the story, especially because good data allow us to have good models. And here's the part where you really work, especially in collaborations with different partners as well, to allow us to pick the best and most appropriate forecasting models for disease spread that can be used for different country scenarios. And we work around with Mitiga Solutions, which is another startup that focuses more on the natural hazard sides, to develop early warning systems, just like you have for weather forecast, but for epidemics forecast as well. And last but not least, sustainability is the key here. So the business model that we have in place is that the data that we are collecting with governments, it's their data. So they will always have access to this information. It's their data, each country has their app, and they will have access to that, obviously, for free because it's there. But once you aggregate and anonymize all this data, we know that when it comes to epidemics, and unfortunately we can see that very clearly around the world today, it's not just a health issue. It's not just a government issue. It affects everybody. So we are betting on that generalized interest in preventing business preventing disruptions in their operational areas by having better information to avoid those disruptions. So we are providing B2B SaaS subscriptions to paying customers as well, who can get access to, again, insights and informations in their supply chain of how they may be affected by epidemics or other social risks in general. So this duality of data sharing being part of what we do is intrinsic to the business. And that is what we thought it would be interesting to change from within as well. So this is not more about data sharing being an afterthought. Data sharing is already part of that business model. And I think this is what the difference lies. And we're also exploring the different kinds of risk transfer solutions, because once you have these science-driven triggers of problems, you can actually link that with the different kind of financial instruments, such as parametric insurance, that can actually transfer the risk to the capital markets so that you can have access to funding based on the science that you are developing very early on. And if you have that money early on, then you can actually build resilience much earlier as well. So we are working with building on the work that has already been done by Mitiga Solutions and the Red Cross on developing parametric insurance or cat bonds, in particular for volcanic hazards. And we're trying to do the same thing for pandemics. So I can talk a little bit more about that. And of course, South Africa is the starting point, but we are creating AFIANet, which is a network of African research and the National Health Institutes that are interested in leveraging these kind of digital solutions for allowing them to identify and forecast diseases much quicker. We're likely to start rolling out the same work that we did in South Africa, in Mozambique, in Kenya next, and we have expressions of interest from all these other countries as well. What makes us different? Well, as I mentioned before, we're working very directly with national government, and this is not just about COVID-19. It cannot be about COVID-19 only. And this is the part that I think I get a little frustrated when I see the proliferation of apps out there for COVID-19, when we know that COVID-19 is one more disease. So I think here is important to embed and think long-term about disease surveillance and forecasting, and working directly with the governments all the time. Again, it's not just about collecting data, it's about an entire early warning system that starts with data collection, but it goes into modeling and it goes into inputs that can actually be used, just like the National Health Forecast. We see the National Health Forecast and we don't understand all the work that goes behind it. So it's similar to that. Of course, the way that we are capturing data is very important here. And I think especially for these countries that we're talking about, we cannot rely just on digital breadcrumbs from the web that sometimes other organizations do. This is about collecting data directly from citizens. And with data, you have better models. And I think this is critical here. And of course, the sustainability part is what I described earlier. And I think this is key, because a lot of times people have good ideas, and I know this for a fact because I come from an organization that has lots of good ideas, but you have to, if you want to think long-term, you also need to think about who pays for what and how do you sustain this in the long time. Of course, a lot of this work has challenges. It's not challenge-free. Data privacy and protection, of course, is always going to be an issue here. And that's why we're creating a global data protection board, and where we want to really bring the best and the brightest and the practical considerations when it comes to data protection to this issue. I think we have also seen that there is a lot of reluctance, and it's very associated to the point that I made earlier on how you take a stance on data issues, how to use data, how far can we go. And I think the key here is transparency, is how you really make sure that what you do is communicated well and communicated simply and directly. The other challenge that we see, and it's not new, but there's always an illusion that we can do things internally. And I've seen this a lot with governments, with nonprofits, that if you want to go into this area, we'll just hire a data scientist and we'll do this. And sometimes for me, it's very short-sighted, because that's not their business of work. And then oftentimes you cannot either afford a data scientist, or you don't really have the infrastructure to sustain this in the long time. And that's why for us, having that freemium business model is critical as well. And last but not least, and that's the part that I cannot see what it's there because it's covering my, sorry. It's where you really look to understand if there is going to be a market appetite for these products. And this is something that we definitely want to find out. And that's why we're developing this early adopters program, to talking to some of these companies to see if they would be interested in becoming paying customers for some of these insights. Now the next steps. And this is where we're looking for collaborations. If you guys are interested in doing more with your superpowers, here is where we can have a chat. Of course, data collection is not always straightforward, so we need to think about incentives. We have some ideas in place, but definitely we'd love to explore more what can be done in this area, from behavioral economics to gamification principles. We also want to use different kinds of data science techniques to improve the incentives for acquiring new users, for keeping existing users. We would love to explore different ways of collaboration to allow us to validate the sample techniques from the crowdsourced data to make sure this is done right, and it means that this data is right. There are different ways to do that, and I think it is an important way. And again, I can never see with full screen. And of course, running disease models, different kinds of way to do that, especially in emerging markets, would be something that we would be happy to collaborate. So with that, I'm finished here, and this is my email. And if you're interested to reach out to me in collaborating or have some ideas, I'll be happy to talk to you. And I thank all of you for your time. Thank you.
Thank you very much, Natalia. I don't think there is a button here for clapping our hands to you, but thank you very much in the name of everybody. There's been a number of questions that I am going to pass to you. I think the three of them mentioned challenges that you have mentioned in some form or other, but maybe you could comment a bit more on all of them. One is about the motivation of the users to use the app. What you have mentioned that's a problem, and how do you, if you can share some of the ideas of how to do that?
Yeah, so right now the incentive is that we have a pandemic, so people feel much more motivated to contribute to the app, but we're already thinking more in the long term when COVID is sorted out, but there are other diseases that we want to continue keeping an eye on. And here there are different things that we are dabbling with. One would be the more you use the app, perhaps the more access to discounted microloans you could have. This is more related to Africa context, but it could be an interesting way to keep people always there. Of course, we don't want to give money per se, because you could distort the incentive, but discounts or maybe like a loyalty program that allows them to also take care of their health as well, and maybe access microloans could be interesting. And there are other organizations doing that. We're also looking into, as I mentioned earlier, gamification principles that would be interesting to make the app itself more interactive. and there's a lot of gamification principles that we could play around with. So you can gain points, you can level up the more that you can have streaks, you can, you name it. But obviously right now it's just a survey on a mobile phone, but there are ways to make it more engaging. So we are definitely looking into ideas in this space. Insurance in general, ownership of the data, like what can you do with the data? How do you want to start? So there are many ways that we can explore this area.
Thank you. Clear. Another question that you've also mentioned is about the importance of open data. And the question is, could open data sometimes pose a privacy risk by exposing personal information of individuals or a small group of individuals? And I suppose that links to, I add this myself, how do you build trust in your stakeholders that you're going to ensure that nothing too private leaks out?
Yeah, well, I mean, the data is not open per se. It's not like anybody would have access to this data. The data belongs to the government, and that's why we work directly with them. And even for us and a small number of researchers that are involved, the data would always be anonymized and aggregated, so that anything that comes out of this will never go into that kind of level of granularity where you actually can link that to individuals. So it's more at a populational level, and that's what it's interesting here anyway. But we don't collect personal information anyway. The only identifier that you have is your email address. But we do ask questions in the intake questionnaires about your zip code and the zip code of where you would work. So there's some information that would be more or less more personalized. But again, that is only analyzed at an aggregate and anonymized level.
Thank you. There is another related question. I'm not sure if you can add much more. This was asked during your description of the Venezuelan migration issue. It's a question that shows up often in my experience in any forum on data for good. Can the collected data be used for social bad? For example, how to persecute immigrants and kick them off to their country? I don't know if you want to comment anything on this.
Well, I mean, again, it's not individual level data. So we don't know anything about, we never, in particular in this case, we don't, even like in the case of Twitter data, whenever the data was collected, it was already anonymized even before you went through analysis process. I guess if somebody wants to do that, obviously there are ways to do it, and I'm not here to create a how-to for bad use of data. There's always a way to do things in a more evil way, for sure. But I think once you are into the space, the idea here is that you should always take the precautions of moving away and trying to anonymize your data as you are handling it for research. And that's how we have always done. In cases where you have corporate data involved, there are also mechanisms to keep the data anonymized. So for example, in the case of CDRs in Chile, the data never left Chile. The data was always, if we wanted to do any analysis and we wanted some data science to look at the data, they had to actually go to Chile and work in the premises of Telefonica. And again, it was already anonymized, but there are many other precautions that you can put in place to make sure that the data is safeguarded in a good way. But obviously, that intent is always going to be there. And I just think that we just needed to do a better job and safeguard the work that we're trying to do for good.
Thank you. We should be closing. Maybe let me finish with something that is on my own, of my own, and not exactly a question, but more like an expression of admiration. I find it amazing that a small and young startup can sit on a table with governments and big agencies and so on, and discuss about such things. I would not be surprised if you were doing this from UNICEF or from a big corporation, but the fact that they are talking to you, I find tremendously amazing.
Well, I think, to be honest, I've been in both sides. I know it's much easier to sometimes to open doors when you're representing a big organization like UNICEF. And I think in general, the Data for Good space tends to be, as I think I mentioned before, an exclusive club. If you're UNICEF and you talk to, I don't know, Bloomberg or Microsoft and you want their data, they're more likely to pay attention to you if you are UNICEF rather than a small nonprofit organization as well. I think in this particular case, what we're doing is going directly to governments, offering a solution to a problem that exists, and really working in partnership. And I think this is the difference here. Like, nobody's imposing anything. There's always a win-win, and we are adapting things to their needs. So what we're doing in South Africa, the way we have done it, the app that we have created for them, works in that context. Now we're moving to Mozambique. There might be something completely different. And I think this listening mode is very important, rather than a lot of times organizations or even individuals already come with a predetermined solutions for a problem that might not even exist as such. So I think listening and being humble is the way to go.
Thank you very much, Natalia. We should stop here, but really thanks in the name of everybody for such a talk from the trenches almost. Thank you.
Thank you so much, everyone.
Good. So we proceed now to the first paper, regular paper of the conference. It is actually the best paper award chosen among a few finalists. So it was not a straightforward decision. The paper is on modeling labor markets for fine-grained insights by Hendrik Santoso Sugiarto and Yipeng Lim, and Hendrik is going to make the presentation.
Okay, can you hear me? Not so, test.
Yes, we can, yes.
Okay, thank you. And thank you for the award. It's very humble experience for me. I will sharing. Okay, how do I share my screen?
You have in the bottom bar, share screen. Okay.
Okay. Okay, can you see my screen now?
Yeah.
Yes.
Not yet. Can, right? Okay. Thank you, everyone. Good afternoon for those who in Asia and Australia. Good morning for those in Europe, probably in US till midnight. Thank you for all that attending this session. Today my name is Hendrik Santoso Sugiarto. I'm from Living Analytics Research Center, which is a research center in Singapore Management University that focus on using data science to do some living analytics in Singapore. Today I will presenting my works on modeling labor markets for fine-grained insights. Because this is a social good workshop, I will talk less about the technical aspect of the model, but talk more on the data science aspect. So just some motivation, as we know that today's people applying job through job portals or other online platform, right? And we also realize that labor market changes rapidly and many jobs being distracted and many new jobs being created. Many jobs become obsolete already, especially in this pandemic, COVID-19 pandemic. We realized that suddenly many jobs disappear and many people cannot grasp what's going on and what's to do next. So I think that is important. There is a need for data-driven framework to analyze job and labor markets quickly, especially when the economic situation drastically changes. And there is a need also to modeling individual applicants, not only global labor market, but also individual applicants and jobs attributes, and how to use it to analyze the trend and biases in the labor market. Okay, this is some related work that related to this work. There is a traditional labor markets analysis and statistical or econometrics model. Usually the labor market analysis, they estimate from the aggregate indicators. For example, they do survey or they analyze from the graduate data and so on. And usually it's quite costly because they need to do survey and ignore a new kind of jobs or application. And there is also weakness on this statistical economic model because they need to design experiments to estimate specific economic variable, and usually it's not only costly but also limited to certain domain. That's why I think I already mentioned before that we need to develop a data-driven labor market model to do a data science study. In this presentation, I will focus more on this data science study to do a fine-grained insights for different granularity. Okay, usually in the labor platform or job portal, you will observe something like this. There is a user, for particular user UI, which is one particular user from the set of U, and specific job from the set of P. So its job PJ has usually they put an offer salary, which is from the interval between minimum offer salary, I denoted as WJ minimum, and maximum offer salary, WJ maximum. And we can also observe the application between the user I to the job PJ. So AIJ is defined as 1 if the UI, user UI, is observed to apply to job PJ, and 0 otherwise. This is the observed data that we usually encounter. Some data is more complex, they have job description and so on, but mostly we only have this kind of data. Then here I introduce a probabilistic labor market to calculate the probability of the user UI applying for job PJ. And I introduce three criteria usually: salary-based probability, and topic-based probability, and accessibility-based probability. So this AIJ salary is this probability. If we multiply this probability, we will get the final probability better this user applying for job PJ. And for the accessibility criteria, I will start from accessibility first, because access is referring to whether the user has access to the job or not. It can be a systemic access. Maybe specific user don't have any access to the job at all. The system prevent the user to apply. Or level access, probably only available for specific education or specific job experience. Or there can be today I will focus on this encounter access, whether the user UI notice there is a job PJ or not. Basically, this is a quite simple calculation. If the user put more effort, probably the user try to find a job 1 hour, and the user will try to put 10 hours to find a job. Of course, the user would that have more effort, have more possibility to find a job. Maybe even the job is very invisible. They just search to find different kind of job. And this is the QI, the user effort, and RJ, the job visibility of job J, which is represent how visible the job to the user. Maybe the job is in the first page, it's very visible, and different job is hidden in the behind the system. So if we multiply these two, we will get the probability. So the user effort, we will limit it to between 0 and 1. Similarly, job visibility between 0 and 1. And the probability, this access probability will be between 0 and 1. Even the user have access to the job, the user may not interested to the job because the topic of the job is different. So suppose the topic factor of the user is, we denote it as yi, which is topic factor of user I, and cj is the topic factor of job pj. If we calculate the cosine similarity, how similar this topic, user topic and the job topic, we will find whether the user UI is matching with the job PJ based on the topic. So this is the second criteria, the topic criteria. Then we have also another criteria, which is salary criteria, whether the user UI is interested to job PJ based on the salary. Basically, if the offer salary is higher than his or her reserve salary, this reserve salary is like expectation, what the salary expectation that the user have. So if the offer salary is higher than reserve salary, of course, usually the user will take the job. If the user have access and the user and the job matching, and if the salary is satisfying, the user will take the job. However, we realize that usually the user may have a different optimism. So we will define the optimism as continuous variable between 0 and 1. So the user will, if the optimism mi is equal to 1, we assume the user will focus, it's very optimist, right? So the user just try to target the maximum offer salary. If the optimism is 0, the user will target the minimum offer salary. It means the user is very pessimist. So if we, basically this is the overall equation to summarize all this principle. So if the user is very optimistic, the mi is equal to 1, this term will be disappear. The user just focus on the whether how different the offer salary, the reserve salary of the user. If the mi is equal to 0, this term will vanish, and the user just focus on the minimum offer salary, and the differences will decide whether the user interested on the salary or not. And we pick we use a sigmoid function to convert this to 0 and 1. If the difference is very big, the user more likely have probability, higher probability to apply for a job. If the offer salary and the reserve salary is equal, the user have 50% probability to applying for a job. And if the offer salary less than reserve salary, the user have low probability to applying for a job based on the salary. So we can multiply all those three probability, and this is the final play diagram model if we want to summarize previous principle, previous criteria. So our model is, the objective is learning the hidden latent variable based on the observed data. In our data, we have the observed data, which is whether the user apply for the job or not, and also what is the offer salary of the job. And we want to learn from the model, we want to learn what is the topic of the job, topic of the user, whether the job is feasible or not, whether the user put more effort or not, and also the reserve salary and the optimism of the user. So reserve salary, optimism, the offer salary combine, these three combined together will decide the salary criteria, and the job topics and the user topics combined together will influence the topic criteria, and the feasibility of the job and the effort of the user will decide whether the user has access to the job or not. And based on these three criteria, we will decide whether the final probability, whether the user applying the job or not based on the observed data. I will talk less on the technical detail. Maybe I just do some evaluation on the model, whether the model can learn all this variable well. Basically, there is two evaluation. For now, I just focus on the application prediction task, because the other evaluation is whether the latent variable is learned correctly or not. And as we know, the latent variable is not observed. The only way we evaluate it is using synthetic data. But I will skip that part. I will focus on the real data, whether the user can predict the application or not. So I will introduce several baseline. This is some simple baseline to do some simple prediction of the optimism of the user, the salary of the user, the effort and the visibility of the user and the job. And also there is a topic-based model, which is NMF and LDA, as we know, to recover the topic of the user. And also some PL, our model, PL, the reduced version of our model, which is the PLM that have only salary and topic component, and also topic and accessibility component. So based on this baseline try to recover the latent variable, and from latent variable we try to do a prediction task. And the dataset that we want to use here is first is Singapore job datasets, which is the jobs bank datasets initiated by the government. Actually, this dataset is quite unique because the government require all legal job to be posted in this portal. Why? Because the government want to local or citizen has access to the job first before the job is offered to immigrant. So this is a way to government to protect their citizen. That's why in this dataset we have more complete legal job that available in Singapore. But this dataset is not open. We sign. There is an agreement to our lab that discuss with the government to obtain this dataset, and it's not open. So we offer another dataset which is more open in Kaggle. You can access the dataset here, which is job portal Wusuf in Egyptian. However, since it's job portal, it's voluntarily posted. That's why the job here is not complete as complete as Singapore job post datasets. But never mind, we will compare this to job posts and try to use our model to evaluate the application prediction. I will use a matrix which is AUPRC, area under the curve of precision recall curve, and I use 5-fold validation, and this is the results, and we list the baseline with the topics, and also there is a baseline with topics, and this is the number of topics K. So for example, if K equal to 3, it means we use an MF model with 3 topics. Similarly, if K equal to 30 and PLM, we use PLM or PLM model with 30 topics. So as we can see, this is the Singapore Jobs Bank datasets, and this is the Wusuf Jobs Portal dataset. And we can see that actually the performance of the model with topics is better than the model without topics. It means that knowing the topic is very important for the user to decide whether they're applying the job or not. So this is our first observation, and we also noticed that our model is performed better than the reduced version, which is PLM is performed better than PLM-DA, perform better than PLM-ST, and perform better than NMF than LDA. So it means that our model is perform better across different number of topics. And as we see also, by increasing the number of topics, the performance of our model is improving. But the increment of the performance is decreasing over time. So from 3 to 5 is improving a lot. From 5 to 10 also improving a lot. Then from 10 to 15, the improvement is not that big. Until from 25 to 30, only 1% improvement. So I think it's safely to stop at maybe 25 or 30. So we will use 25 as a number of topics and do further data science study. So first we maybe focus on the topics. So if we focus on the Singapore jobs bank datasets, this is some topic example. So its major topic may correspond to labor segments TL. This T is the factor. So suppose we do cosine similarity between the topic factor of the user UI with any factor. It will show how match the topic of this user with this factor, right? So we can pick any factor to represent this T. For the moment, I will choose the factor that correspond to this topic, which is if the element of the topic, so for example, we focus on topic 1, if the element of that factor is, so we put some value on the element of that factor and put to the rest. So we want to find a user that have cosine similarity with this topic larger than 0.5, and we will put it in this set user UI UL. Similarly, for job PL is any job post that have cosine similarity with this topic higher than 0.5. So this is the number of user with this topic and the number of job that match with this topic. So if we pick some most popular job title in this particular topics, we can see that actually many job title is similar to each other because they are belong to the same topic, and we can see I just label it as clerical because all this job is related to clerical jobs. Similarly, we can have another topic like secretarial or finance or marketing and public relation and accounting, human research lab, and so on. Actually, this is just few examples. We have 25 different topics because we learn the model using 25 topics. And I just show some few examples that have more popular user and jobs. Then after we can learn the topic, we can use another reserve seller, another latent variable that we have learned using our model and try to do more granular analysis. So here we pick 13 highest topic. Then we can see that this is the optimism of the user and the effort of the user. There is a lot of things that can be analyzed from this data, but maybe we just focus here. We just focus on, there is a financial aspect here. We can see that most of the user is put more effort to find a job, but they also optimistic. It means they targeting the higher offer salary. They targeting more on the higher offer salary. In contrast, if we compare with these clerical topics, the user there is also put more effort to find a job, but they are less optimistic. They try to target a lower reserve salary. This is one type of data analysis that we can use after we recover all the latent variable in the model. Similarly, we can, if we have more information, we can do further analysis. For example, if we have gender information in our data, we can analyze also which labor segment is more popular to certain gender. For example, this is the percentage of female applicants. We can see that this one, HR, accounting, secretarial, clerical, usually dominated by female applicants. Most of the applicants are female, and this labor segment, for example, IT, trading is usually dominated by male applicants. Not only that, if we analyze the proportion of the latent variable that we have learned, so we know that what is the reserve salary of the male applicants and also reserve salary of the female applicants. Here I take the median. median reserve salary of the male applicants, and I divided by median reserve salary of female applicants. Interestingly, that the reserve salary of the male applicants generally is higher than the female applicants across different labor segments. Of course, there's some exception like accounting. The reserve salary of the male and reserve salary of female tends to be equal, and also other labor segments. But at least there is an indicator that female applicants and male applicants behave differently across different labor segments. Of course, this is can be an indicator for example, like gender pay gap. Maybe it's like psychologically male tend to have higher reserve salary than female. And also, if we analyze other latent variables, for example, here in IT, the male have a put more higher effort and is more optimistic than female. And of course, this is analysis for labor segments. We can do more granular analysis, its individual applicants, and also its individual jobs. And we can suppose we have different kind of data. For example, its data. We can analyze different things. For example, if I divide the age between any applicants that below 30 and any applicants above 30. So as we know that usually applicant below 30 has less experience, right? So usually they behave differently in the labor market. So we can see that trading and research and marketing segment is dominated by younger applicants. And also, it's not surprising that reserve salary of the younger applicants generally lower than older applicants. It's not surprising because I think usually older applicants has more experience. That's why they have higher expectation of the salary compared to the younger applicants. And it's common in across different labor segments, except like similarly accounting and clerical. In clerical, I can understand because usually the experience is not that important for clerical jobs. Yeah, this is some example. There is a lot of other example how we use our model to do a data science study for fine-grained insights, especially for those variables that's hidden in the data. So we can recover it and use the variables to analyze the market. And this is the other potential application of this model. For example, for job seeker, they can understand the market situation, how many competitors they have, how many people similar to theirs, and they can use it to set reasonable salary expectation. Maybe if the salary expectation is too high, they have difficulty to find a job. If too low, maybe they lost something. And it can also help them to determine right amount of job seeking efforts. Maybe in this labor market, they need to put more effort. In other labor market, they need to put less effort. Also for employers, they can understand the market situation. They can set appropriate salary to attract talent. Maybe if the salary is too low, there is no applicant. If they increase the salary, there is more applicants applying for their jobs. And maybe their job is invisible. They can put more advertisement to advertise the job visibility. Also, this is important for a policymaker also, because policymaker need to understand the market situation objectively, and so they can do policy making in targeted manner. For example, when we say that okay, our labor market is in shortage, so the question is which labor segment is in shortage, so they can do policy making is in more targeted manner. For example, they put promotion or certain education or adjust the immigration policy and so on. Also, for example, for if there is there is a gender discrimination, for example, they can ask more like which labor segment has this kind of problem, so they can do targeted policy making more efficiently. And also, for example, they can attract job investment to particular labor segment also. This is some potential application that our model can be used. And so this is a conclusion. In conclusion, we propose a probabilistic labor market model, PLM. And this PLM can recover the hidden users and jobs latent variables or characteristic. And this PLM analysis can reveal many interesting things in the labor market that maybe we don't realize before, like labor market segments, or there is an interesting pattern on gender and age. And for future work, we can do more analysis like labor economies, calculate the supply and demand in particular labor market, or even we can do like interpretable job recommendation. So not only we recommend job, we can give interpret give a reason why we recommend this job. Maybe because the topic is matched, because the salary matching and so on. Yeah, this is my presentation today. Thank you for listening for my presentation. I will open for question and answer after this.
Thank you very much, Hendrik, for a nice and very clear presentation. I can see in the chat only one question, and it is by me actually, which is about if you have tested in any way the interpretability or explainability of your model and your results to somebody that is not you. In particular, I would be interested to know if people like employers or policymakers would be able to understand what you've done and the model, and if these would match their intuitions.
Yeah, unfortunately, we only test in our lab mates because we don't have a system to be used by policymaker, or I mean online system that can be accessed by user and also job also companies. The problem is the data that we have is quite old, because recently the government, as we know, if we interact with government, sometimes this year the government open data, sometimes not, right? So it's quite difficult to get latest data.
Okay, thank you. It doesn't have to be necessarily show them results, but more to understand if they could be interested in actually diving into the model. But okay, future work. Yeah. So I think we stop here for the session. If there is...
Ricardo?
Yes.
I think there is a question on the chat from Zoom, from Fernanda.
Oh, I see.
Yeah.
I cannot see it as a question, but maybe I'm not seeing it all.
Okay. Then...
It's congratulations for Hendrik, saying it's nice work, and especially because you used real data, and this instigates a lot of analysis.
Okay.
Right?
You're right.
Thank you.
Good. So there are no more questions. I think we should stop here. Thank you very much, Hendrik and Natalia. And we will meet again in about 16 minutes. It's 11 at 11 ECMLPKDD time. You translate to your time zone. Thank you very much.
Dark and rainy as well. We have 3 very interesting papers in the next session. Let's start with the first one. It's about understanding animal behavior from camera trap data.
Hello, are you able to hear me okay?
And it will be presented by Benjamin Evans.
Let me ask you one thing, Benjamin. Can you leave your camera on?
Is it not on already?
Yes.
You like me to turn it off, sorry?
Turn it on and share your screen.
Yeah, the camera should
Okay.
be on.
Okay, thank you.
Are you able to see my screen as well?
Yeah, nice.
Fantastic. Thank you very much. Welcome to, I think, what is part one in this session of the Alan Tucker Show. I'm going to be talking about my work on reasoning about neural network activations and application in spatial animal behavior from camera trap classifications. This is a collaboration with my supervisor here at Brunel, Alan Tucker, and two others from the Institute of Zoology in London, Ollie Wern and Chris Carbone. I'm a second-year doctoral researcher and housed as part of the London NERP DTP. So, let's begin. First of all, don't know how familiar people are with camera traps. I'll give you a bit of background. Introduce the data set that we're working with and should hopefully be opening up later in the year. Talk about how we've gone about doing deep learning for detection of animals within images, and then later on to the species classification. Looking into prediction of species occurrence at the different locations of our camera trap study, utilizing Bayesian networks and identifying behavioral patterns between what we're seeing, and onto a bit of future work and summing up after that. So camera traps, I'm afraid I haven't got one to show and tell here today, but it's this thing strapped to a tree. They're usually deployed by ecologists over varying regions around the world, and they consist of a camera and some form of sensor. These sensors can be an infrared sensor, most commonly, and previously, or still are, tripwires and can be just a timing module. These have got a bit of history, and they go back to days of using a box brownie camera setup with a tripwire. When an animal goes past, it grabs a picture, hopefully. Few problems with them. Sometimes the PIR sensors, the range of view is actually larger than that of the camera sensor. So the trigger might be set off, but the animal's not actually in view yet. So they're usually set up to take a sequence of images. We tend to set them up so that once the trigger has been set off, it then continues to take 10 images 1 second apart. So then hopefully we see it walking through. This gives us possibilities to do other things and actually seeing how fast they move, which can be linked to the health and things of the animals. They're growing in popularity, likely based on the decrease in cost, but the technology has been advancing a hell of a lot. We're also seeing it being used in other sectors, not just for ecology, but security has also been popping up. So with the decrease in costs and the increase in the tech, these data sets are growing and growing, much like pretty much everything in the machine learning applications. So with it becomes the labor of actually going through each of the images and labeling what is in each picture. So this is usually done by humans, but because of such demand, ecologists have been looking into automating this, and deep learning appears to be rather fruitful in its possibilities. So there's quite a few researchers and organizations now around the world looking into using deep learning for this classification. Early days, it was based on a whole image classifier, which is a bit limiting in counting the number of animals in it if you've got a whole family of species walking through. So this has then led on to detection. So we get a bounding box of where each of the animals is in each image through the sequence, and can separate that out to then do a species classification, or it can be taken as part of the detection model in the first place. So we've been having a think about it, and we've had a fair bit of a play with the actual detection and species classification, and then thought about how we can progress things after we have an amazing model for the species classification, which leads us on to this work. So the data set I'm working with is called Borneo Cam, collected by Oliver Wern in northern Borneo. And the full data set consists of about 600 camera locations, and they're not all out at the same time, but for this region, OG3, all of the cameras are placed and out about the same times, and then moved to another location. So because of restrictions and things, we've just worked with this OG3 subregion, which isn't a huge area, but it is good for working with for now. So this consists of 47 cameras, 95 species, still quite a lot of images. So we're planning to publicly release this data set later on in the year, if all goes to plan. So the OG3 region that I'm working with, this is the species distribution of sequence for species frequencies. So we have a lot of images that are empty, lots of sequences that are empty. And this is just a trigger going off for some apparent reason. Might be that there is an animal, but it's just never quite in view, or it could be bushes and sunlight and things like that triggering it off. So that leaves us with a rather long tail distribution. And so because our work is not focusing primarily on the actual species classification detection as such, we've taken the top 6 species, but we have merged both the red muntjac and the yellow muntjac, as they're extremely similar. Pretty much the only difference is a little patch on their head, so can actually be really hard for a human to classify what they are anyway. So that leaves us with 5 different species that we're working with on this. So for detection, working out where the animal is within each image, we're using a generalized model called the mega detector, which has been developed by a team at Google and Sarah Beery and a few others. And this has just been trained on loads of camera trap images from around the world. It detects 3 classes: animal, human, and vehicle. So we're pulling out all of the animal bounding boxes, and we've trained a specialized species classifier just for our region. So the idea of this is that it can be swappable. If someone's done a study in the area before, they can use those images as a basis for training a specific classifier. So we use ResNet 50 V2 architecture with average pooling, dropout of 0.2, and training softmax activation at the end. We pre-trained this on an ImageNet model to speed up the training process. First of all, we did 5 epochs with the just training the classification head, and then we did another 5 with layers beyond 150 through the model unlocked, so they can all learn with a lower learning rate, which improved the results. So here we can see the confusion matrix. Pretty good. We can see a bit of confusion between the long-tailed porcupine and spiny rat, and that's because they have a similar sort of brush tail thing. be good to have a look at it through GregCam and stuff, but that's our sort of hypothesis of why there's confusion there. So identifying patterns, we've got locations, we've got species, and we can introduce time. So we've got all of the activations from our species classifier, and we've summed them up by location and time at hourly intervals. This we then threshold, so that we have Boolean, is that species there or not in each individual hour. And we learn Bayesian network structure. So we try a few different algorithms. Hill climbing we seem to get good results with because it always produced a completed DAG. So that all the connections between things where it makes a connection actually has a direction as well, which is important for later prediction. We then fit a training set of these intervals to the DAG, which then forms the basis for actually making the predictions. It gives us the prize. So results for actually predicting occupancy at different times, fairly reasonable. There's still just a lot of discussion around what statistics are the best, what we should be looking to improve on with ecologists, as will change depending on the problem or what they're researching. But I feel these are significant results into this direction. What I find really interesting in this is actually an earlier step from making the predictions, and it's when we learn this network structure, this graph structure. So we've got different ways of plotting these. What you're seeing on the screen here is a geospatial plot of the regions, and with a network learned just on an individual species. So these links that we can see in the individual species could quite well be where the species is walking through or not walking through. But when we start looking at all species, it gets really confusing in this view. So if we have a look at a full graph view, sort of without the geospatial constrictions, we can see the links identified between things. So if we look in this zoomed in view, we've got OG3 W38 muntjac. So the W38 in this context is the ID of the camera location. We've got southern pigtail mackerel pointing towards the muntjac variable. And this is showing that they are linked. Now this could be that when we see a southern pigtail mackerel, we don't see a muntjac, or they're both seen usually there together. But then we can look into influence across the different cameras as well. So we start to look into whether things are traveling together, whether it's just one site that we're usually seeing a link. And this allows exploration backwards from getting the data to then trying to understand why this is happening. So more traditionally, come up with a hypothesis of how a species may behaving. This means we can do it backwards from the data. So for this is early days sort of thing. This is yeah, just in the second year. So we're looking to extend this work. We've got additional data sets where we've got more geospatial features that we can also link in. So proximity to water points, rivers, but also in human settlements, whether or not animals tend to congregate nearer to houses or not. So in urban environments, we see things with foxes where they're adapting. But at the moment, we don't really incorporate time of day either. So adding variables actually saying which hour, see different patterns as the day goes on, potentially. And whether or not we see links between weather and behavior be really interesting, both through measurements on the ground and satellite imagery. And currently, as I said before, we're thresholding all these activations. So we're getting meaning from them, whether or not the models believe something is there. We've been thresholding at 0.5. But we can hopefully start to look at using activations as a representation of how much the model, the classification model, believes that species is actually there. So we're looking to utilize that in the future. So this is the overview of our workflow to generate, sort of work through the method. In summary, it's identifying behavioral links automatically from the data set. Predicting missing, from this we can predict missing information where there's enough information to be confident about our predictions. So camera traps fail a fair amount of the time, whether it be from a full SD card so they can't write, or batteries failing, or animals coming and stealing the cameras or playing with them and shaking them about. So say if we had half a study, we may be able to then predict what might be happening there for the latter half of the study. We've taken as a generalizable approach we think is sensible for the time being. Maybe one day we will have a species classification model that generalizes all the way around the world, if that's the approach that is to be. But at the moment, having a generalizable, all generalizable bar just this individual specific deep learning classifier for the species in that region, we think is quite fair and works well. And the Bayesian networks are all learned based on the activations from the neural network. So there's no other human input required. So I think that sort of summarizes it up. It's my email at the bottom, and very welcome to any questions.
Thank you very much, Benjamin. Such an interesting application of machine learning. Let me have a look. Are there any questions in the chat? I don't see any. Okay. Maybe I can ask a question to start with. Did you discover something new? Some new knowledge, for example, about how the animals move, interact, something surprising, something new that was not already known based on your Bayesian network or your approach?
That's yet to be discovered. Sorry, I'm getting echo. That's yet to be discovered. So I'm working with with a bunch of ecologists on this. I myself am not an ecologist. I'm a bit more into computer science, but it's looking promising that we're identifying things that we've not really thought about before, at least with the people that I've been working with.
Okay, thank you. Let me have a look. Yes, there is a question by Fernanda. What were the challenges about using data from cameras in an open environment? And there is another question.
So the data sets, I've not done so much with the actual collection, but I think your question is more about the actual data afterwards. So there's some standards that have come about on how to actually store the information about what's been seen. This is more for the actual classification part. So we usually have to write a whole bunch of software to parse and convert the formats that each individual ecologist has labeled their data in. But it's much the same challenges as I think any other machine learning problem, in that it's lots of data wrangling in the first place to get going. Yeah, that's I think it's a general problem. There's nothing specific to the camera traps that has come up.
Okay, thank you. And there is one more question. Why did you use Bayesian network? Is there any particular reason for this? What was the advantage?
Bayesian networks, they're quite, I mean, we can explore them quite well. I mean, if we were pumping all this information into a deep learner, for example, to try and predict the different locations, there's various different ways of trying to understand deep learning models, right? But nothing like Bayesian nets, where we can actually inspect the priors, the probabilities of what it's seeing. I think that makes a big difference. Yeah. Okay, thank you. Let me have a look. How are we going with the time? Let me have a look. Okay, so we have 1-2 minutes, additional minutes for questions. Are there more questions? Okay. If not, let's thank Benjamin again. Thank you, Benjamin. So the next presentation is about practical lessons learned from generating synthetic healthcare data with Bayesian networks again. And it will be given by Alan Tucker.
Hello there, can you hear me, everyone?
Yes, we can hear you.
Perfect, okay, let me just share my screen. Okay, can everyone see the screen and see my presentation?
Yeah.
Perfect. Okay, so thank you very much for allowing me to give a talk on this. It's actually quite an interesting time because we've just released some results from this, which I'll talk about at the end. My name's Alan Tucker. I head the Intelligent Data Analytics Group at Brunel University, London, in the Department for Computer Science. And the title of the talk is Practical Lessons from Generating Synthetic Healthcare Data with Bayesian Networks. Now, healthcare data, as I'm sure you all know, holds a lot of value. So firstly, societal value in terms of, somewhere buried in our data sets, our healthcare data sets, is a great deal of knowledge about disease, how it manifests itself across a population, and how it progresses over time. And if we can extract that information, then obviously we can do things better in terms of healthcare, in terms of interventions and understanding and being able to treat disease better. But there's also a monetary side to this. And so there's a great deal of interest from health tech companies in trying to get hold of this data, because they see it as a valuable asset where they could learn things and make that a commodity to sell. So, unsurprisingly, many health systems have tried to explore making this data available to people. Now, in the UK, we have a huge amount of data. In fact, the NHS, because it's a state system, it's one of the largest collections of health data in the world. And there's a lot of interest from governments in trying to make this data open so that people can learn useful things from it. Unfortunately, when this was attempted recently in 2014, there was a project called care.data, and it was literally the week before it was about to go ahead and release all of this patient data. There was this clamour from many different interest groups who said that this was potentially illegal because of the privacy issues, that personal data would still be available even though there was pseudonymization and a great deal of effort in trying to make this data private. And the whole system collapsed, so it didn't happen. And more recently, they're trying to do something similar, so commercializing medical records in the UK. And it seems almost certainly now that they're going to back down once again after a second attempt for almost identical reasons. So as a result, because of this problem with healthcare data, and in particular primary care data, so primary care data when people first visit their GPs, holds extremely sensitive information. So in the UK, it's not just about symptoms, there's also lifestyle information. So when you visit a GP, they actually record all sorts of information about that visit and about that individual. So very, very sensitive information. So it's become increasingly of interest to governments and institutions that there could be a way around this problem where we don't release information, but we use synthetic data as a substitute. So if we can create synthetic data sets which handle all of, well, as many of the complexities of real world data as possible, but at the same time minimizing the risk of matching synthetic data points to real patients, then we kind of get away from this problem of personal information being released, whilst having all of the value of those original ground truth data sets. And that's exactly what we've been doing. So this is a collaboration between Brunel University and the Department for Health, in particular the Medicine and Health Regulatory Authority, who holds all of the primary care data for the NHS over decades. And what we've been interested in doing is trying to generate synthetic data sets. And the aim here is being able to release that data in a relatively open manner, so that institutions like universities or health tech companies can develop and validate their apps with real data. So we looked at using a class of models known as probabilistic graphical networks. This may also answer slightly Xiao Gamma's question to Ben in the previous talk. I'll talk a little bit about why these are particularly valuable, and they were popular in the 90s, and I believe they're kind of coming back again, in particular in healthcare. So graphical networks like this model probability distribution over many variables. So you can see an example here on the left of a network where we have a graphical structure which encodes conditional independencies between variables in your data set. And we have local conditional distributions at each node. So what this does is allows us to see the structure of your data set, but also we can learn these models from data. And then once we've done that, we can ask what if questions. So we can enter information into the networks, and this allows us to then calculate the posterior distribution. So see what impact that observation has on the rest of the data, of the rest of the variables in your model. So in terms of synthetic data, this is really useful because we can learn these models, we can inspect them, so we can look for biases that are in this data, which there almost certainly will be, and we can hand tweak them. So we can have experts, epidemiologists and clinicians who can tell us whether there should be an independent relationship or not. On top of that, we can also marginalize the synthetic data we generate. So for example, if this node up here, X1, could be whether someone is from a particular region or a particular ethnic group or a particular gender, and we can enter that and say, we just want to generate data from this region, or we just want to generate data from female patients or from a particular ethnic group. And so we can actually fine-tune exactly the synthetic data that we generate. Another nice thing about this class of models is that we can do all sorts of machine learning techniques and algorithms on them. So we can use Bayesian networks with specific topologies to do classification. So you can see an example here where we have a node representing a class node. We can also extend them into time. So we can model temporal or longitudinal data sets using dynamic Bayesian networks. And we can even use certain algorithms like the EM algorithm and variational techniques to learn networks with latent variables. So you can see here an extension of a dynamic Bayesian network where we have latent variables. So we can incorporate all of this information and all of these techniques to really fine-tune some of the models that we generate to really capture some of the complexities in primary care data. So why aren't we using GANs? I hope I've given you quite a few reasons as to why probabilistic graphical networks hold certain advantages. So there's a huge push at the moment for using GANs for many things. And they work in a really nice way. They actually generate simulated data to help fill in gaps sometimes within your training sets, and to improve, obviously, models for doing things like classification. And there's an example here from the data science campus where GANs were used to generate synthetic data, in fact, from census data in the US. But we've really shied away from that. And the reason is because we're not comfortable with generating data where we don't know the underlying relationships to some degree. In fact, we're worried that if we release some of these data sets, it could actually fail the GDPR. So it could actually mean that we've generated data where we fixed a relationship between two variables where it's prejudice, and we want to make sure we're not doing that, obviously. So we have this risk of transparency. We need to know the dependencies that are represented, and we can't see that with GANs. We're worried about bias. So whether we're learning biases in the historical data that we don't want to exist in our synthetic data sets. And we also want to hard code knowledge about things like known biological relationships within the synthetic data generator. So in this study, we looked at two data sets. Firstly, a well-known, well-studied data set that's freely available, MIMIC3 from the US. And this details the stay of a patient. It records diagnoses in the form of ICD codes, as well as demographics, ethnicity, age, religion, postcode, stuff like this. It's a large study. We actually, for this study, dealt with numerical data by discretizing it, though since this paper has been published, we've actually extended it now with continuous data too. The other data set is from the UK, so it's the CPRD primary care data set. The one we worked with covers 21% of the UK population and goes back for 2 decades. And this one we were interested in going slightly further than with the MIMIC data. We wanted to exploit some of the temporal nature of this data. So we have repeated visits to our GPs for many patients, and we want to see if the Bayesian network, the probabilistic models, can be extended into time for generating synthetic temporal data, in particular focusing on blood pressure, so systolic and diastolic blood pressure. So the experiments were as follows. We would infer either the Bayesian network or the dynamic Bayesian network from MIMIC from the CPRD data and parameterize them. We used a score and search approach with Bayes information criterion to score it. We then hand inspected those structures and updated them if necessary. And then we generated synthetic data, so the same amount of data as the original ground truth data sets. And then we compared a number of different things. Firstly, we looked at the correlation structure with the static data sets with MIMIC. On top of that, we also looked at the cross-correlation function and the auto-correlation functions in the dynamic data sets to see if we were capturing the correct dynamics within the temporal data. And we obviously also looked at the distributions. And then after that, we simulated an attack to see if we could, in fact, match real patients to a synthetic data point to see what the risk was if we could actually say in particular rare cases, so if we have an outlying patient from our distribution, is it actually trivial to identify personal information from a synthetic data point by matching them to a real patient? So here's a structure from the MIMIC data set. As you can see, many relationships, lots of interconnectivity, nothing really surprising, in fact. So this was very nice. It really demonstrated confidence that we were seeing exactly the right sort of independent structures over the different variables within our data set. There were, however, some relationships that were missing, and we did add those. So we expected to see certain relationships between things like circulatory health and age and blood disease and whether infection was present or not. So it allowed us to hard code those in before we parameterized the model. Once we did that, we generated the synthetic data sets and compared. And firstly, we looked at the correlation structure, which was incredibly similar, not identical. You can see here, so we separated out the variables at the top, which were discretized, and the already discrete variables at the bottom. And we found very similar, so not significant different correlations between the synthetic data set variables and the ground truth data set variables. So this was good. This is a good starting point. Obviously, it doesn't capture everything. It doesn't, for example, capture more complex multivariate relationships here. This is something we're actually looking at the moment. If we now look at the distributions in the MIMIC data set, you can see a very tight fit for a number of variables here. It really captures, it locks down very similar to the distributions. So we have a lot of confidence here that we can use these synthetic data sets if we're interested in capturing distributions and similar correlation structure. If we now look at the CPRD longitudinal data sets, what we did here was, because we were just looking at a small number of variables, we actually encoded this in a form of hidden Markov model. So we had a hidden state and tried to capture the relationship between diastolic blood pressure and systolic blood pressure in patients over time. And we looked at a fourth order model, hidden Markov model. What we then did was very similar approach. We looked at correlations, but we also looked at autocorrelations and cross correlations. And what you can see here along the top is the relationship, how similar the synthetic data and the ground truth data was in terms of things like the difference between systolic and diastolic blood pressure, the standard deviations. And you can see here, many of these statistics, very similar. They sit very close to one another on that diagonal. So they're very similar characteristics. If we look at the dynamics, so here we have the autocorrelation for diastolic on the bottom left and bottom middle, the autocorrelation for the systolic, there does seem to be a bias. So it seems to be that the autocorrelations were substantially lower than the ground truth. Now we're currently exploring why that should be. One reason could be that the fourth order model may be not enough. We need to look at higher order models to capture more complex dynamics. In fact, so ones that lack with larger time lags. We thought the hidden variable should capture this, but it hasn't quite. But whilst the autocorrelation functions are slightly biased in this way, interestingly, the cross-correlation functions, so the correlation structure between different variables, between the systolic and the diastolic, actually are very similar. So we seem to capture that relationship very nicely over time. And so what we see here is that this class of models do seem to capture this data very nicely. Not perfectly when it comes to longitudinal data, but many of the underlying characteristics of those original ground truth data sets we can capture and reproduce in synthetic data sets. So what I want to talk about briefly now, though, is can we then just release this data, make it completely open because there's no risks to privacy? And we've obviously distanced ourselves slightly from doing that. In fact, the government has panicked about us trying to do that and said, well, no, we don't want to do that yet. So we still have many checks and balances before we release this data. One of the risks is outliers, as I was saying earlier. Now, if you imagine you have a patient, and if you look in the top left plot here. I hope you can see this. We have red and blue data points here representing ground truth data and synthetic data, and they overlap a great deal. But we also have outliers that sit well out of the main distribution. This is just a small sample. Now, if we have outliers that are one synthetic and one ground truth, then we could argue that this kind of person who has very specific, very unique symptoms or data could be linked to a small number of synthetic data points, and therefore we could infer new information about them. So what we did was we simulated a hacking approach. Let's imagine we have an unpleasant person who knows something about an individual, so some common knowledge, maybe their age, whether they smoke, where they live, maybe their gender and ethnicity, and maybe they could capture some other information. Maybe they've had a hospital visit, so a small amount of information. Could they take that information if they got hold of the synthetic data, match them up to a synthetic nearest neighbor, and therefore infer everything else that's stored in that synthetic data point? Obviously, if this is possible, this renders the entire approach very, very risky. So what we did was we simulated this for different amounts of ground truth attributes that may be available to a hacker. And you can see in the table on the top right, the different rows showing increasing amounts of information that someone may know about an individual who may have access to that synthetic data set. And really the most interesting thing that I want to focus on here is how the number of single synthetic nearest neighbors to those individuals, unsurprisingly, the more information you have, it reduces it. So the number of single synthetic nearest neighbor points becomes less and less, which means you can focus and make with higher confidence a link between that synthetic data point and that real patient. However, if you actually look at the proportion of ground truth outliers that have one single synthetic nearest neighbor, the proportion is very low. So we actually see 1 to 2%, and that is just of the ground truth patients who are outliers. So nothing to do with all of the ground truth patients. So there is a small risk still, but it is what is deemed as probably safe enough risk for us to explore this further. But one other thing that I want to point out is, even if you do make a match between a ground truth real patient and a synthetic data point, that doesn't necessarily mean that you can make a safe inference to say you can learn other things about them. And there's an example here at the bottom where we've linked one ground truth data point, so ID1 at the top, and a synthetic data point, ID2 here. And if you actually look at the things that they've tried to infer, they're actually quite different. So whilst they have similarity in some respects, so the thing that's linked to them is they have similar age, 88 and 86, similar BMI, similar blood pressure, they both smoke, female, and live in the West Midlands of the UK. When you actually add the synthetic data to see what you can learn about them, there are still significant differences. For example, the actual real patient suffered a stroke and the synthetic data set didn't, and they both have very different cholesterol ratios. So even if you make this nearest neighbor approach to linking patients to synthetic data points, it doesn't necessarily mean you can learn personal information about them. Okay, so I hope what I've shown you here is some of the methods that we've been working towards trying to make synthetic data available that captures the complexity of the real world data sets, but where we have faith in those underlying relationships that are generating the synthetic data. And also that mapping real patients to these synthetic data points is actually not that easy after all. In fact, since the paper was accepted here at the workshop, things have been really taking off, in fact, with the collaboration. We've gone further, we've been exploring with a number of companies and universities how we can use synthetic data to assess state-of-the-art machine learning models. This is from a combination of random forests, which we used to try to predict cardiovascular disease. And you can see, actually, it's not perfect yet. So what we have is the red and the blue represent ground truth data results when you validate it, and the blue is synthetic data results that we've released. They're not the same, but the characteristics are very similar at least. So the precision recall curves, you can see we're capturing very similar shapes, if not perfectly identical yet. Exciting news was that a few weeks ago, in fact, 6 weeks ago now, we have actually released 2 data sets using this approach. One on COVID-19. So COVID-19, as we know, arrived in Europe sometime, we think, maybe December to February. There's some evidence now that it did arrive probably nearer December and it just wasn't detected. Now we're interested in seeing if machine learning can be used with our synthetic data from GP visits to see if there was in fact a signal in the synthetic data that could allow us to say, look, there's clearly something, a signal that appeared earlier in the UK, which would have allowed us an early warning signal of the pandemic arriving. And we've also released another data set on cardiovascular research. So this is now freely available with some checks and balances via the MHRA website. And we've also extended some of this work now, assessing the synthetic data sets on a number of different machine learning models. It's just been accepted in Nature Digital Medicine, in fact, accepted yesterday. So this publication will actually show where we've been working towards since the paper was accepted. So finally, I just want to thank the team, in particular Name and Juan, who really led the data science groundwork supervised by Zenchen at the MHRA and led by Pooja Miles. They've really been key to this collaboration, and we've now just got funding from NHSX to extend this work on the track and trace data. So what we're interested in doing now is bringing in spatial information, not unlike Ben's talk, in fact, where we can actually look at where COVID has spread and moved around the UK. If we can simulate that in a synthetic way, then obviously the personal information about where people are at a particular point in time goes away, and we can actually try to model this and make it freely available for machine learning research. So thank you very much. If you have any questions, please let me know.
Thank you. This was an excellent presentation and very interesting work as well. I'm looking at the questions, so very interesting work. Another person, thank you. Okay, so the question, GANs are known to suffer from the so-called mode collapse, where they focus on generating very well one type of instances, ignoring the others. While the generated instances individually are realistic, the population as a whole isn't. Have you investigated this possible drawback? This means that you cover the whole real population sufficiently well and not just a subset.
Okay, it's a good question. In fact, it's a perfect question for me. So so GANs, we are actually currently exploring GANs. We've had a lot of pressure from NHSX who say, why don't you use GANs? Why don't you use GANs? And indeed, with a GAN, you have the concept of an output, so an input and an output. And as a result of that, when you train it, it's always going to be focused on whatever you choose as your output. So the nice thing about probabilistic graphical models is every single node is an input and an output simultaneously. So you can ask those what-if questions. So that takes away some of those issues. What it doesn't take away is issues of bias in your data. So if you have, underrepresented groups in your data set, and this is a problem really for any machine learning method. But what we can do is we can explore that because the model is very transparent. We can see for example, a relationship that should be there that isn't there because of the bias. In fact, what we could do is even go one step further. There was a really interesting talk earlier in ECML. It was is it called the Test of Time talk? I do recommend you go and have a look at it. And it was from, I think, 10, 20 years ago, about having biased data and how you can overcome bias in your data using naive Bayes classifiers. So you can actually hard code and update your data with knowledge to say, well, we know that this data is biased and we can overcome it so it doesn't, you know, display that bias when we come to generating the data. So yeah, it's a great question. I think it's not trivial dealing with bias in your data, but the idea of a model that focuses just on particular types of data because of a selected set of outputs, I believe we are dealing with by using this family of models.
Okay, thank you very much. Just one more question, probably. Let's have a look. Yeah, great answer. Okay, so just before we move to the next presentation, you mentioned the risk of matching real patients to synthetic data. I found this very interesting. I never thought about this. So this was something important that I learned from your presentation.
I think it's really important. I think there's a lot of drive to make data available. And I think it's a major risk. Things like pseudonymization, I'm not convinced by pseudonymization. I think that's risky. But even this approach, we're still very paranoid that the moment we make this stuff available, you know, you could have lawsuits. We're being very careful about this. And yes, I think that is a risk we have to watch for.
Okay, thank you very much.
Thanks.
So we have to move to the next presentation. Okay, so it's from the same group, I think, and it will be given by Sayed Sayadi, and
Yes.
the building trajectories over topology with, that's a long title, TDA, PTS. So this is an application in modeling temporal phenotypes of disease. Okay, Sayed.
Hi, let me just share my screen. Can everyone see my screen and see myself?
Yes, we can see.
Okay, fantastic. So yes, my name is Sayed Sajjadi. I'm a doctoral researcher in Brunel University, and within my second and third year, so quite advanced into my research. My research paper is titled Building Trajectories Over Topology with TDA PTS, an application in modeling temporal phenotypes of disease. So let me start off by giving you a little overview of what the presentation is going to be. So initially, I'm going to talk about the motivation of the research. What is it? Our objectives, some challenges, how the research overview was conducted, and then the main chunk, which is our novel methodology, the new algorithm, the combination of TDA and PTS, discussing the data sets that we use to test this algorithm, some results, discussions, and finally some conclusion and further work that we are currently undergoing. So let's start off by the motivation. So our motivation is to model temporal phenotypes of disease. So essentially, the main aim that we're trying to work through is to discover temporal characteristics of disease progression, identifying the shape of the disease, so the topology, how the data set looks in a topological sense, modeling how the disease could progress from a healthy patient to a patient that has a more serious disease or further progression in that disease sector. And then hopefully detecting patterns that show how the disease progresses within a data set. And then finally, the main goal or the main motivation is to be able to create personalized medication and procedures. Obviously, that is beyond the scope of my research, but that is what the good SoGood research is going towards. So our objective in this research was to create a novel algorithm that will robustly build trajectories through the discovered topology from patients' data. Of course, in every data science problem, there is a lot of challenges. Some challenges that we faced and we knew that we were going to face, and we did face them, was the lack of temporal information in the generated topology of the data, lack of time series data. A lot of the data that we have isn't time series, so we don't have progression of a single patient, so we can't see them how the disease has progressed within that patient within first year, second year, third year, unfortunately. And also there is some random trajectory formation when we start to create these trajectories within the data sets. So a little research overview, how we conducted our research and algorithm. So initially we explored the current algorithms that are out there, which is the topological data analysis, which is relatively novel, but it's becoming increasingly popular because it looks at the shape of the data and the topology, which shows us a lot of information that is not seen when you just analyze just the data, but when you create a shape, you can obtain a lot more insightful information. And also looking at PTS, which is pseudo time series, which looks at the time series side. So trying to combine these two algorithms and create something even more robust. So initially we tried to obtain data. So the data that we have got, I'll run through it in the next slides. The data that we achieved, they are, majority of our data is publicly available, and they are anonymized, and the data that we have, you can't relate it to, there are previous data that have been used for other researchers. So the data isn't the essential part of this research. The essential part is the algorithm. The data is just to reconfirm the algorithm and show the robustness of the algorithm. Obviously, the data that was used was not for this research. It was data that is used in other researches. So the data had to be pre-processed in order to have it in the format that we require for our analysis. Then from that data pre-processing, we go on to our topological data analysis, which is creating the topology within the data set. And then obviously when we get this, the outcome of the topology, it's not perfect, and we have to enrich it in a way that is more meaningful for our research. When we have enriched the data set, we can import it into our pseudo time series. And then the results are further enriched to see the trajectories and to analyze what kind of outputs we have. And then obviously with every kind of algorithm, we need to reevaluate and enhance our algorithm when we do this process. So let me go on to talk about how the TDA PTS process works. So initially we project the whole data cloud to an embedded space, as you can see there, and just display that as a star. Then we partition the embedded space into overlapping bins, which you can see in a different color reading. We've got the red, yellow, green, and blue. We partition the data, and we control the amount of overlap we want in these bins, and we require an overlap so that the data points can be linked together. Then after that, we use a clustering algorithm. The clustering algorithm is dependent on whatever the data scientists would like to use and what is more effective for that particular data set. So when we have done that, we create a clustering algorithm to cluster the points in the data cloud. Then each cluster of points in every bin represents a vertex of the graph. So it represents an edge of the topology. Then because we have overlapping bins and we have vertices which have common data points, we can start creating edges. And these edges are created by using different metrics, different distances. You can use Euclidean distance, which is one that we use to find out which distances we want and how to link these vertices within the bins. And then finally, we can enrich the graph, as you can see in F, and we can enrich the graph by population, by the density, by the majority vector within these vertices, to give us a more meaningful topology. And then we can start to create a PTS model on top of that to create trajectories that go from a start point ideally a healthy patient or a patient that is at the beginning process of their disease and then progressing through until the finish, which is someone with a really far progressed disease, and hopefully seeing how the progression will be and to be able to intervene for clinicians. A very quick summary of how the algorithm works. Like I said, we have a section data, we have class sets of these data. So the data set that we do have, we know which patients are healthy, we know which patients are have the disease. So we're not trying to identify which patients or predict which patients will have disease. We're just trying to intervene with the already data that we have. So initially, we create a filter function, and that filter function is, we find the range of the filter functions. And like I said in the previous slide, we determine the length of these bins and the amount of overlap, how much we want the overlap to be. Obviously, we don't want too much overlap and we don't want too little overlap. So the trial and error was done initially until we found the parameters for the different data sets to be able to be more effective. After we've created that, we get a adjacency matrix, which links up each of the vertices and tells us the distances, what significance these distances have. And then from that, we are able to create a weighted distance matrix. And with this weighted distance matrix, we can now be able to find out the significance of the overlapping vertices. And then when we have this weighted distance matrix, we're able to extract that and have our topology. And then from that, we're able to use pseudo time series to map out some trajectories and to be able to see what these trajectories show to us and further analyze them and enrich them further to be able to find meaningful results. And then finally, obviously, the output would be a pseudo time series model based on a topological data analysis graph of a particular data set that we used. So in this research, we used 3 different data sets. Firstly, we have the simulated hidden Markov model data, which is a simulated data used from an augmented hidden Markov model with 2 variables. This enabled the manipulation of underlying states to direct the topology of the data, and we handcrafted the model to simulate multiple patient time series with 5 underlying states. And we'll see in the next slide how the data branch into two different sections and how we could map out trajectories. The second data set that we used was a diabetes patient data. Now, this data was previously collected for the Mosaic project. The health record accumulated from 924 pre-diagnosed patients. And with the good thing about this data is quite complex. So we were trying to see if our algorithm can cope with complex data that had a lot of attributes, such as systolic blood pressure, diastolic blood pressure, high density lipoprotein, and so on and so on. And then finally, the more exciting part, more of a unsupervised learning, is the genomic cancer data, which we had 3 different cancer data sets, lung, pancreatic, and renal tumor, which all of them, we combined the data sets together. There were separate data sets. We were able to combine them together and have a different class for each of the cancer sets and have their control or their healthy patients as one class, so that we can see, regardless of which control patient we have, how do these disease progress? Is there a correlation between different cancer sets? And if there is, how can we intervene through that? And as you can see, there's further information on where these data sets have come from. I won't go into too much detail on where the data set has come from. You can see it on the slide there. So let's talk about the results that we achieved. So the results from the simulated data, as I was explaining in the previous slide, you can see the 3 different trajectory samples that we have there. The red vertices show us the healthy patients. Then we have 2 different color vertices there, which is one is blue and we have purple, which is the 2 different disease sections. as you can see that the starting point and the main cluster, which is the large red vertex, which is the healthy state, which is quite good that it clustered in a certain region, so we can be sure that we have majority healthy patients. So our start point is a very, very good start point. And then the data naturally just split up into the two different the two different disease states as we have here. So we had one nice trajectory to the top and one nice trajectory towards the bottom. Now on the right side, you can see the distribution of the data over the vertices. And it's quite interesting to see that from the beginning, you can see the distribution is quite small. So therefore we know that is majority healthy patients. As it progresses through in each three of the graph, the distribution increases, which shows that it's capturing different patients, different disease states, and then finalizing itself into a more concentrated disease state as well. So it gives us quite interesting information on how the disease is progressing here. Next, we go on to the diabetes patient data. Now, the diabetes patient data, like I said, it had real underlying time series, which allowed more realistic trajectories. There's three types of trajectories that have been discovered. The blue vertex showing the data with multiple comorbidities, and the red one shows none. And on the right, you can see the different associated, on the right of the trajectories, are the association distributions of the key features for that phenotype. If you remember, we said about the systolic blood pressure and so on. All of these attributes in the BMI, you can see how the distribution changes as the trajectory goes through. And the nice thing here that you can see is that the first phenotype is characterized by the most features decreasing in value over time. The second phenotype shows an increasing trend for hemoglobin and triglycerides, but more stable over other features. And the third phenotype is characterized by much more variation in the middle stage of the trajectory. Now, the combination of PTS and TDA has enabled complex temporal phenotypes to be categorized over a topology. So here, our main goal was to see how it would cope with realistic complex data, and we can see that it has coped quite well. We can see the distributions of the different characteristics, which gives us a signal that maybe we can use these attributes in order to find out how the disease is progressing within, for example, diabetes patients. Finally, we have the genomics cancer data. Now, the genomics cancer data is three different data sets that we use. Like I said, we have the lung cancer, pancreatic tumor, and the renal tumor. And all three of them are gene expression data. So we have huge amounts of data. Now, the initial thing that we had to go through is to be able to sort this data out, because using all of the data would be very time consuming and computationally is very exhaustive. So, and we know that a lot of the genes within the gene expression data aren't affecting the actual cancer patient. They're not vital. They're not contributing to the disease progression. So here we can see three different trajectories that we have mapped. The top left one, which is in the green, shows us how the disease progresses from a healthy patient to the final lung cancer patient. The second one shows us, again, from a healthy patient, disease progression to pancreatic tumor patient, and then finally from unhealthy to a renal tumor. Now, again, similar to the simulated data, we can see the cluster of red, which is the healthy patients, are quite nicely collected together, which shows us that this topology is not just a random topology and is actually taken in the attributes of the patients, the gene expressions of the patients. And finally, the trajectory begins, as you can see, it starts to begin from a predominantly healthy, and it goes on to a mixture of patients. You can see the distribution increases, and then finally it goes off to a majority of a certain type of cancer patient. Now, because, like I said, the gene expression data was a huge amount of data, we after we conducted our initial analysis, we started to extract certain genes that are expressed quite a lot. As you can see, these 3 different graphs under each of the topology, next to each of the topologies, are 3 identified genes that are expressed quite a lot. So, for example, gene 219787 in research has been identified as the ECT2, and the gene expressed is quite increased in the lung trajectory. So if we look at it, if you can hopefully see it here, you can see that this gene that we're talking about starts to increase as we go towards that lung cancer. We can see that it's starting to be expressed more and more as we go towards the lung cancer. So if we didn't have this information that this gene is actually responsible for one of the factors that could lead to lung cancer, from just this research and seeing this gene, we can see that this is a factor. And obviously, when we did further research and we found out that there are papers that support that this gene is a major impact in us identifying lung cancer patients. And furthermore, these other 2 genes as well, which are also identified genes, gives us a promising start to see actually we can start looking at the genes and seeing how the genes are expressed within different cancer patients or other type of diseases, and then being able to start intervening when we start seeing an increase in one of these genes, to start intervening and being able to help these cancer patients or different patients for different diseases. Finally, let's go on to some conclusions. The novel approach we achieved was the TDA and PTS, and was described as the aim to create realistic disease trajectories over meaningful topologies based on graph theory, distance metrics, and expert knowledge on staging within a disease, which we were quite successfully able to do that. By applying TDA and PTS, we create a more robust analysis, and we're able to find out more insightful results, which is very, very good. Now, the simulated data experiments show that the approach can successfully extract underlying temporal phenotypes from starting states to multiple end states. That was very, very effective. The diabetes data, like I mentioned, showed us that this TDA and PTS approach was able to cope with the complex temporal phenotypes, and it could extract distinct characteristics that move from early stages to late stages. And then finally, the genomic cancer data, which does not have any temporal validation, but it showed realistic temporal phenotypes transitioning from uniform healthy states through diverse intermediate states, and finally ending in a uniform but distinct cancer state. So we can see that we don't really essentially need the temporal validation. We are able to use the gene expression data to be able to create that realistic temporal phenotypes. The further research that is currently undergoing, and it's going quite well, I'll start off with number 2. We know that from, because we use a slight unsupervised learning approach, we will get transitions or trajectories which are impossible. So for example, going from healthy to one cancer, then healthy cancer, that is quite unrealistic. So we have started to implement rules and conditions to eliminate transitions that are impossible, to break up those links that get created. And then we want to apply our TDA and PTS to medical data that have more attributes. Obviously, that is quite hard to achieve, as the previous talks have explained. Getting data which is anonymous and getting the trust of that data is quite tricky. But from these 3 initial data sets that we use, it shows promising opportunities that if we have a data set that could be gene expression and have more medical attributes, we can create a more robust algorithm and to be able to test how robust this algorithm can be. And then finally, we would like to see if we can implement some expertise knowledge. So use clinicians' knowledge and further knowledge within each data sets to be able to create a better topology and a more robust trajectories for specific data sets and not just a generic one that we have just created. And thank you very much. That has been my talk. I'll open the field for any questions that you may have.
Thank you. Another very interesting work on an important topic, and very nice presentation as well.
Thank you.
Are there any questions? Okay, so maybe I can ask.
I think there is one in the chat. Do you want me to read it?
Yes, yes. Can you please do this? Yes.
Yeah. It's thank you. What data size do you estimate you need to build your models? Thousands, hundreds of thousands, to know if it would be feasible to apply to a relatively rare diseases or a relatively small organizations?
So that's a very, very good question. Obviously, the bigger the size of the data, we will be able to find more information and be able to cover a lot more attributes. But it comes to the fact of how, if we compromise the computational side of it. So we don't want the data to be too large, like just like how we use the gene expression data. A lot of the data from that gene expression wasn't really relevant and didn't really affect the entire data set. So the bigger the data, the better, but we will have to eliminate a lot of the sections that won't affect it. We are only looking for the highly expressed data. So it can be applied to small data, but like I said, it won't capture everything that we want for it to capture.
Okay, thank you. I think that there is another question for the attendee.
Mm-hmm.
I don't know if you can let me allow to talk.
Maybe you can just unmute and ask the question.
Yes. Hi, thank you for your talk. So my question is that it seems this trajectory in a lot of cases, they start at the same point, as you said, a uniform, healthy state, and then transition to also uniform but diverse end point, which is so here, how do you deal with the inter-patient variability? Does this also play a role?
Yeah, so like we said, we know where our start point is and where our final point is. We distinguish that. We can define that within the algorithm for it to start at a healthy state, and we want it to go to a specific cancer point. Where it goes as it transitions, that is the unsupervised learning approach that we are taking, which it will show us insightful information. So when it goes through a section which is quite diverse and it has quite lots of different patients in there, we can start looking at different attributes that are causing that trajectory to go through there. And when we see what attributes are causing that, that could give us an incentive to explore that further. Maybe that trajectory was mapped out because there's something insightful there, or maybe it's been mapped out because it shouldn't have happened. So we have to set some boundaries in what we want it to do. But like I said, we want it to be unsupervised to be able to capture as much as we can and find out which ones are more insightful for us to do further research into that.
Okay, then this the immune system, whether it's strong or not, you could imagine, like for example, couldn't have an effect on the tumor patient, but those characters and characteristics indicating the immune system, whether they're strong or not, they vary among patients. And how do you take that into account?
I'm not really understanding your question. So are you talking about the diabetes data?
So in general, there are some patient-specific information that could be indicative of how fast they will progress or how likely they will progress into a certain disease, and how severe they can progress into a certain disease. How do you like calibrate this variation?
So at the moment, we haven't gone that deep into the data because that is relevant to what data we will achieve. So the data sets that we have don't have that kind of information for us to be able to embed it. If you were at the end of my talk, that was the further research that we are trying to get into, to find a data set that has more insightful, just like you said, there are characteristics that will drive the trajectory. We want data sets like that. But unfortunately, not much data set is out there for us to be able to use. As soon as we can, then yeah, we can use constraints in order to be able to shape the trajectories the way that that it should go through. But like I said, it's going to be unsupervised. We want it to take the routes that it can, and then for us to further investigate to see if that attribute is the reason that is driving, or maybe there's a different underlying problem that is driving these trajectories.
Could I just add something, Irfan, as well? Just, I think so. If there's patients that respond, let's say, in different ways to a disease or to a drug or whatever, you would expect to see some of those changes in the data space. So they would sit in a different place in the data space. And so Irfan's method here would naturally find trajectories to different regions in that topology. So in some ways, Irfan's approach should capture those differences between different groups of patients if it's evident within the data. I think, I'm not sure, I wasn't sure of the question and whether that's what you meant, but sorry, I just thought I'd jump in, Irfan, and help out.
Thank you.
Yeah, no problem. Yes, and thanks for the feedback. Yeah, thank you.
Thank you.
Okay, so